to the Sepsis Awareness In-Service. This in-service was created by a recommendation that came down from the New York State level IPRO. Many of you may be aware that IPRO is a national organization that works on improving services, motivates more efficient use of resources, and has the goal of achieving better patient outcomes. It was determined that due to the severity of sepsis in the community, a lack of both community and hospital-based awareness existed. So the Centers for Medicare and Medicaid Services, or CMS, began a community-based sepsis initiative. Out of this initiative, training material was provided to us as New York State is the first to implement some of these protocols. In this in-service, I will provide you with the basic information you will need about sepsis awareness. But first, let's take a look at what the project focus was and the goals and objectives before we get started. The project focus investigated the effectiveness of quality improvement interventions to increase diagnosis and treatment responses to sepsis that, if implemented, would greatly improve healthcare quality and result in reduced mortality, harm, healthcare disparities, and overall costs. The goals and objectives are to facilitate educational opportunities to build awareness of sepsis among pre-hospital healthcare providers and the public in the target market communities. Also, to identify best practice protocols and educate pre-hospital healthcare providers on the recognition of sepsis and establish systems for efficient referral to the next level of care for emergent care management. Next, to improve processes of care transitions between pre-hospital and hospital emergency care setting providers and post-acute discharge to the community. Lastly, to increase public awareness of the signs, symptoms, and contributing factors to sepsis through community outreach, public service announcements, and social media. Let's take a look at a short video about what sepsis is.
Sepsis, formerly called blood poisoning, is usually triggered by a local infection, such as pneumonia in the lungs, an infected wound, or infection of the urinary tract. Should bacteria from the local infection spread or secrete toxic substances into the bloodstream, the immune system may sometimes go into overdrive, causing inflammation throughout the entire body. You get sepsis. This interferes with the blood flow, which leads to a drop in blood pressure, making it difficult for the blood to carry oxygen to the body's major organs. This can lead to failure of organs such as the lungs, the kidneys, or the heart. In the worst cases, the patient dies in a matter of hours. Detecting sepsis early is crucial, so be attentive to symptoms such as fever and chills, breathing difficulties, diarrhea and vomiting, confusion and slurred speech, low blood pressure and elevated heart rate, low urine production. Sepsis can affect anyone. Help us stop sepsis.
So let's take a look at what sepsis is. As the video stated, it is an overwhelming and life-threatening response to an infection. It has been known to be stated as a toxic response to an infection. Think about all of our home care patients that we take care of. We have patients that we take care of that have pneumonia, wound infections, urinary tract infections, post-op wound infections, or just general post-op infections. If sepsis is not treated promptly, it can result in organ failure, tissue damage, and even death. Early detection of sepsis is critical. An unbelievable 54% of U.S. adults have not even heard of sepsis. Prompt actions could save a life. Oftentimes, it is the community health worker, whether it be the nurse, the home health aide, physical therapist, occupational therapist, speech language pathologist, or even the social worker who goes into the home and sees those early signs that could definitely lead to saving a life. Early detection and treatment is critical to decrease morbidity and mortality related to sepsis. Can also avoid long-term health-related complications. And lastly, potentially avoid hospitalization. So let's take a look at who is at risk for sepsis. Anyone with an infection anywhere in the body. And we mentioned some of those situations a little bit earlier, but let's think about our average home care patient. Our average home care patient is possibly going to be 65 or older. We also have a risk for patients that are in our pediatric populations or infants less than 1 year old. People with chronic illnesses such as diabetes, cancer, and AIDS are also at high risk for sepsis. People that have been recently hospitalized or are recovering from surgery are also at high risk for sepsis. So if we think about our average community health patient, a lot of them fall into this category. Statistically, the mortality rate for sepsis is 29%, which unbelievably is greater than an MI or a heart attack, which is only 25%, or a stroke, which is 23%, and trauma, which is 1.5%. Unfortunately, 18 million people die of sepsis worldwide each year, and it is one of the leading causes of childhood deaths. Sepsis is the most expensive condition treated in U.S. hospitals, and it kills 258,000 Americans annually. So as you can see, early diagnosis of sepsis is often missed, and it is very critical that we learn the early detection of sepsis. The reality is our hospitalization for sepsis is on the increase. We have an increase in an aging population, which we've already identified as our high-risk group. We have an increase in antibiotic-resistant bacteria, which we hear about all the time. We have an increase in people that we take care of with immunocompromising conditions, such as cancer, HIV, and we also have some patients that have been organ donor recipients that we take care of as well. Unfortunately, those patients that are hospitalized for sepsis are more severely ill than those hospitalized for other conditions. They have longer lengths of stay, and they are more likely to die during hospitalization compared to other conditions. Sepsis definitely has an impact on the consumption of our financial resources. It was the #1 cost for hospitalization in the United States. $20 billion can be spent each year treating sepsis in hospitals. The in-hospital mortality rate is 8 times higher than any other diagnoses. It also has an impact on the increased length of stay for patients in the hospital. The cost related to long-term also impacts sepsis. There's significant subsequent medical care and services for long-term. There's a very high rehospitalization rate, and people have a very long delayed return to work in the workforce. So let's just look at some of the early signs of sepsis. And remember, patients can typically have more than one of the following, so it doesn't have to be all of them. It can be just one of them. It can be all of them. It can be some of them. But typically they have an infection, and that can be confirmed or suspected. They may have a fever or just complain to you that they're feeling very cold or chills. They may have a rapid heart rate. They may have rapid breathing. They may have some shortness of breath. They may have some confusion or be difficult to arouse. They may have complaints of extreme pain. They may be pale or have discolored skin. So those are some early signs of sepsis. So this is where we might see them in the home and just have some suspect of sepsis. Some other early signs that may be seen clinically are a decrease in blood pressure. For example, the systolic blood pressure may be less than 90 millimeters of mercury, or you may have a decrease of greater than 40 millimeters of mercury. There may be an altered mental status. There could possibly be a decrease in urine output of less than 0.5 milliliters per kilogram per hour. And you may see some abnormal lab tests, particularly an increase in lactate level of greater than 2 millimoles per liter. Lactate is a level for cellular hypoxia, or the inadequate delivery of oxygen. If lactate is persistently elevated, it's not because the body can't get rid of it, it's because the body keeps producing it. An elevated lactate acid is a signal for an inadequate supply of oxygen to the tissues, and that, unfortunately, is associated with an increased mortality in sepsis. So oftentimes, serial lactic acid levels are drawn to see what level of sepsis a patient is at. You are also possibly going to see an increase in creatinine, a decreased platelet count, coagulation abnormalities, being the INR and the PTT being off. There's also a possibility of hyperglycemia in the absence of diabetes, and that would be a blood sugar of greater than 120. We have a few special considerations for the elderly, and I talked a little bit about confusion and changes in mental status being one of the signs, the early signs of sepsis, so it can be very difficult to tell if the patient is having signs of dementia or signs of sepsis. But urinary tract infection is a very common source of sepsis, so it's very common for that to be their sign of sepsis. So it's a good idea to rule that out if the patient is having more common, frequent changes in their mental status, and the elderly at more risk for UTIs. So, and they oftentimes are patients that have urinary catheters as well. So their symptoms can differ from younger people in that they are more confused, more agitated. Maybe they are complaining of some dizziness or of having more falls. Their behavior might change more rapidly than a younger person. And UTIs are often mistaken for early dementia or Alzheimer's disease. So the best thing to do is just to get a urine sample and rule that out early on, just to make sure that it doesn't turn into something worse. In the treatment of sepsis, every minute counts. So treat sepsis as a medical emergency. Notify the physician as soon as possible if you have any of those signs of sepsis. It's treatable, and it can be prevented from progressing to septic shock, but it must be suspected. So early recognition and treatment improves survival rates. And for every hour that appropriate treatment is delayed, the risk of death increases by 7.6%. There's also something called post-sepsis syndrome, and it affects about 50% of sepsis survivors, and it can leave them with long-term impaired cognitive function, muscle weakness, mobility impairments, and amputation, hallucinations, loss of self-esteem, increased dependency on others, and among the older patients, there's a higher risk of cognitive impairment, which is permanent. Let's not forget about our caregivers. It can have a very big impact on our caregivers in that they have inadequate hospital discharge education on what to expect during recovery, and that's where we come in because we give them adequate follow-up in the community. And then think about the cost of everything, the disruption to their lives. All of this impacts the caregivers in the long term. So out of this community-based sepsis initiative came the New York State regulation that the New York State is the first state in the nation to enact sepsis regulations that is going to require every hospital to have protocols for recognizing the early signs of sepsis and identifying those high-risk patients to ensure that early treatment is in place and that the staff are trained to identify all those high risks. And then there's going to be a metric analysis as a driver of change. The Home Care Association of New York State formed a quality committee and reviewed the Medicare fee-for-service readmission diagnosis. Showed that septicemia was the #1 diagnosis for all 30-day cause of readmission for New York State hospitals. They also showed that no resources and tools were available in the home health setting related to sepsis. So they formed a work group to develop a sepsis screening tool for the home health setting and came up with the Adult Sepsis Screening SBAR tool and the Adult Sepsis Screen Flowchart. The Adult Sepsis Screen Flowchart was beta tested by multiple home health providers, and there was input from prominent physicians at the state and national level, as well as the National Sepsis Alliance. The work group was focused on efforts from pediatric version of the tool for home care. So as you can see, it was tested and screened by multiple providers. The next few slides are going to show what came out of the Community-Based Sepsis Initiative. While HCR has not adopted its own adult sepsis screen flowchart, this is a sample of what could occur on an average home visit. The nurse could complete an adult sepsis screening assessment for each home visit. Based on the 3 questions below, they can do some follow-up. Number 1, does the patient have a suspicion for an infection? Number 2, does the patient have 2 or more systemic criteria present for sepsis? Number 3, is there at least one new sepsis-related organ dysfunction criteria present? The follow-up from the 3 question would be as follows. Answers to 1, 2, and 3 are no. You can stop right there. Complete a new adult sepsis screen assessment at the next home visit. Second, answers to 1 and 2 are no, but 3 is yes. That patient meets criteria for MD notification. You document your findings and notify the MD. Moving further to the right, answers to 1 and 2 are yes, but 3 is no. That patient meets criteria for sepsis. You can document your findings, notify the MD, and draw a CBC. Lastly, if the answers to 1, 2, and 3 are yes, that patient meets criteria for severe sepsis, document your findings, notify the provider, and the patient needs to be transported to the emergency department. The interventions are going to be to refer to the sepsis screening SBAR form for determination of interventions. On the next slide, we'll look at the SBAR form and figure out what those interventions might be. This is the top portion of the Home Care Services Adult Sepsis Screening SBAR form. Does the patient's history, physical examination, or other findings suggest an infection? If so, specify the source of infection. Is it coming from pneumonia, a urinary tract infection, an abdominal infection, meningitis, a bone or joint infection, a catheter infection, a wound infection, chemotherapy, etc. Number 2, are there 2 or more of the following systemic criteria present, such as fever, tachycardia, or tachypnea? Number 3, is at least one or new of the sepsis-related organ dysfunction criteria present from the following list? And it breaks it down into neurological, lung, kidney, cardiovascular, and pain. And the symptoms are listed as described in previous slides. If the answers to questions 1, 2, and 3 above are all no, then stop and screening is completed for this visit. If not, we'll move on to the next slide, which will show us what the follow-up is. The follow-up listed here is identical to the adult sepsis screen flowchart. However, now we see the interventions listed as follows. The interventions in the sepsis protocol are clinically contraindicated. The patient has been educated on the signs and symptoms of sepsis. Next, the patient has advanced directives in place at this time, which precludes any of the protocol interventions. Education has been completed with the patient and/or caregiver on symptom management of sepsis. The patient or surrogate declined or is unwilling to consent to protocol interventions. Provider has been notified of the decision not to receive acute intervention. Education has been completed with the patient and/or caregiver as to the risks and benefits of declining intervention. Also, the patient has met all criteria for severe sepsis and requires immediate intervention. MD has been notified. Patient has been transported to the emergency department and report called to the receiving emergency department. And last, the patient meets sepsis criteria, MD notified, antibiotics initiated, and the next skilled nursing visit to be completed within 24 hours. The bottom allows signs for signature. What are our key factors for success? We all know we need our senior leadership to support us. We also have to have a solid understanding of the signs and symptoms of sepsis. Hopefully this presentation will give you all that understanding. We also have to have agency resources for questions from the field. Use your agency resources such as your manager, your clinical field staff supervisor, your therapy field staff supervisor, and your clinical education department. Also out of the sepsis awareness training came the Stop and Watch tool, which HCR has already implemented. It's a helpful tool to identify changes in a patient's condition that could help be the early signs of sepsis. So stop and watch. If something seems different than usual, if the patient is talking or communicating less than usual, if overall the patient needs more help than usual, if the patient is participating in activities less than usual, if the patient ate less than usual, if patient had no bowel movement in 3 days or has diarrhea, if they're drinking less than usual, weight change, agitated or nervous more than usual, tired, weak, confused, or drowsy, change in skin color or condition, if they need help with walking, transferring, or toileting more than usual. All of these are things that we need to report and could be the early signs of sepsis. So you can see this is already something that we have implemented here at HCR. How can you help? You can familiarize yourself with the early signs of sepsis. Know who is at risk for sepsis. Get to know your patients. Educate your friends, family, patients, and caregivers about the signs and symptoms of sepsis. And be cognizant of health literacy and its implications. Explain the patient's information in a manner that they can understand. Use your teach-back method. So let's talk for a minute about what the teach-back method is. Studies have shown that patients forget 40 to 80% of the information that they receive almost immediately after hearing it. So unfortunately, we have to rely on our information to be repeated several times. The teach-back method is asking people to restate in their own words what has been presented to them, so you can ensure effective communication has taken place. So what I've done in the past is ask the patient to basically just teach me back what I've taught them, so that I know that they have an understanding of what I've given them. It helps gauge the need for re-explaining if necessary. It gives you trust between your patient and yourself, and it creates a good opportunity for dialogue between you and the patient. Ask the patient to just basically tell you what you've taught them and see if they understand it. It gives you an opportunity to know if you need to do further teaching. Let's look at some basic preventative measures. Always practice good hand hygiene. Get vaccinated and make sure your patients get vaccinated against influenza and pneumonia. Prevent infections, treat them promptly, maintain good overall health, and most importantly, know the early signs of sepsis and the need for the time-sensitive treatment.
Our daughter Erin was 23. She went in for a simple hemorrhoidectomy. 5 days later, she was gone to something I had never heard of.
According to a recent poll, 7 out of 10 Americans had never heard the word sepsis.
Many death certificates list the cause of death as cancer. Many of those patients die of sepsis. Many death certificates list the cause of death as complications of heart disease, and the cause of death is sepsis. Many death certificates list the cause of death as complications of pneumonia, and the cause of death is sepsis.
We have about 1 million cases of sepsis annually in this country. And of those cases, somewhere between 20 and 25% wind up dying. There should be no mistake. Sepsis is an equal opportunity killer. It kills the young, it kills the old, it kills the sick. Sepsis is really a toxic response to an infection. And so as a result, instead of protecting you, your body actually starts trying to kill you. The great unknown is the number of people who survive sepsis but are significantly disabled as a result.
It makes me feel good if just one person knows what sepsis can do so that there aren't grave consequences.
This is a disease we could affect today to reduce the mortality rate by 50%, to cut the number of people dying in half.
Remember, sepsis awareness saves lives. Oftentimes, it is the community health worker that is the first one that's going to be seeing those early signs of sepsis. So treat sepsis as a medical emergency. If the patient shows the early signs of sepsis, notify the physician as soon as possible for medical attention. Early, prompt recognition and treatment greatly improves survival rates. Thank you for listening to this presentation, and I hope that it offered you great sepsis awareness.